Looking ahead to the legislative session beginning Monday, a few pre-filed bills seek to address sexuality and gender conversations playing out statewide. One of those bills was filed by State Representative Gabe Firment of Pollock in his second attempt to ban gender-affirming health care for minors. Going into the 2023 legislative session, the focus is on the budget, but non-fiscal legislation is stirring up harsh emotions for some demographics.
Moving forward, if there are going to be substantial changes in health care, in education access, and in all manners of access for the transgender community, it won't happen without a fight.
That fight firing up again on Friday when the deadline to file bills for the spring session closed and Representative Gabe Firment's House Bill 463 hit the legislative website.
Children are not mature enough to drive. They're not mature enough to buy alcohol or cigarettes or to get a tattoo. Why in the world would we allow them to remove perfectly healthy reproductive organs?
Firment's Save Adolescents from Experimentation Act would ban a physician or medical health care professional from providing gender transition procedures to any person under 18 years old. The procedures include puberty blockers, cross-sex hormones, and surgery. Medical professionals would face disciplinary action for providing any gender-affirming care if it were not medically necessary.
What we're beginning to see is just a flood of so-called detransitioners, kids who regret going through these procedures, and we're going to see more and more of that. And my fear is that if we don't get something done, 5 years from now, 10 years from now, we're just going to have hundreds, if not thousands, of kids come to us and say, "Why did y'all let this happen? How in the world could you let this happen to me?"
But for those at Ben Franklin High School in New Orleans on Transgender Day of Visibility last week, the bill is an attack. Greg LaRose, editor-in-chief of the Louisiana Illuminator, was there and heard students' reaction firsthand.
These are kids who, have already made the transition, have contemplated all of the options, and sort of being told basically by lawmakers, look, this isn't an option for you medically. It really hit some very, very hard.
But Firment argues gender-affirming health care is, quote, pure evil. This is the second time Firment has filed this legislation. He withdrew it in the 2022 session, opting for a study on gender-affirming care in Louisiana instead.
There's just no way that a child can consent to something this serious with just devastating consequences like sterilization, cancer, bone density issues, cardiovascular issues, not to mention the extreme psychological impacts.
And while information is limited to only Medicaid recipients, the data LDH collected does not reflect many of Firment's concerns. The study reports that from 2017 until 2021, an average of 14.6% of minors with gender dysphoria received hormone therapy or puberty blockers. 0 underwent surgery. The number of patients receiving care and healthcare providers giving care has steadily decreased since 2018. And the study reports improved mental health for those who received treatment. And less than 1% of those treated as a minor felt regret or the need to retransition.